Get a recording going. All right, so my name is Ken Kinter. I'm an assistant professor at Rutgers University. I'm guessing you've probably heard that already. And the purpose of today's presentation is to conclude our three-part series on stages of change and motivational interviewing. I've altered the slides a little bit, so I think we're going to have time to do a review of some of the salient points of stages of change and the tools of motivational interviewing in case we've got somebody who missed those. The videos and the handouts are available. They've all been sent out by Rutgers, I believe, to Ms. Castle so that they can be distributed so that any of the stuff you see, you can have access to. And you have my email on here. And as I mentioned in the Q&A, put my email down. If there's a question I don't get to today, and I'm going to try to get to all of them, feel free to email me, and I will respond probably today. All right, so today's webinar is hosted by the DBHR through the Healthcare Authority. This is an interactive training, and we encourage you to ask questions and interact throughout the session. What I'll be doing is I'll probably be pausing at least twice during this session to look over the Q&A, answer questions, things like that. And as we mentioned, all these things will be available to you. We also have a couple other sites where this material is available, including my YouTube channel. If you put my name in YouTube, it will come up. Everyone is muted, cameras are off. We already explained about that good stuff. So what we're here to talk about today is, again, just to wrap things up, we're going to talk about stages of change and some of the major points of that, because it's been a couple weeks and y'all are busy. So I'm sure the decay and the forgetting of learning starts as soon as the training is over. So unfortunately, I'm working against time here. So we're going to review those points again. About stages of change, spirit and method of motivational interviewing, as well as the tools, which we got through pretty quickly last time. And what we're really going to bear down on today is change talk. And even though this isn't that terribly interactive, we're going to do an exercise so that you can actually put this stuff into practice on yourself. As I mentioned at the very beginning, I'm more concerned about you being able to use these things for yourself. And then we worry about the clients later, because that adds a whole other dimension to it. And if you like the stuff that you're hearing here, I will give you some pointers about next steps. Again, I recommend the books very highly, but we'll also talk about if you're interested in this like I was and want to take the next steps with it, we'll talk about how you can do that. So just to go back to session one, we're going to we'll review the stages of change and what the interventions are. Because again, this is my idea of diagnosis. My idea of diagnosis is not what the DSM-5 or subsequent versions of it says. I'm more concerned with where is that person in the stage of change? You know, what can we work on? Where can we make some progress and build a therapeutic relationship, which is, of course, the container where all this change comes from. So first off is the pre-contemplation stage, the I don't have a problem stage. And the interventions for that are, hear them out. Where is this resistance coming from? What is the why of why they haven't made this change yet, or why they even refuse to acknowledge that a change needs to be made? There is a valid reason. And until we know what that valid reason is and can see it as valid, we're not going to be in a position to help that person. And our temptation is to jump in and fix. And we try a couple solutions, and when they all fail, the tendency is to blame the client and say that the client is resistant. Where if you get a little deeper into this stuff, they would really say that the problem was ours, that we were just too far out in front of the client. So contemplation is the I have a problem, but I don't know what to do about it stage. So let's find both sides of the scale. What are the reasons to change? What are the reasons to stay the same? And then we can help influence the change process by adding to the reasons to change, or by assessing the reasons that they haven't changed yet and deciding, you know, what can we do about those? Are those based on rational real world things? Are they based on belief systems? Are they, you know, what is the nature of that change? Also finding out what they've tried before and kind of setting the path for, we'll talk about this more in a couple slides going forward, so I'll let that go. Preparation, the written change plan. This is where the person says, okay, I'm getting ready to do something about my problem. Having a written change plan. What is going to be changed? When are we going to change it? Where does that change happen? How? What are the supports? What are the barriers? What has failed before? And how would this fail now if it were going to fail? I love asking that question. And start with small steps. If a change appears too big, the first step should actually be so small they're almost embarrassing. I break my change processes down into, I have a phone call or I have an email to send. And I try to break it into these ridiculously small steps. Or I heard a suggestion from Peggy Swarbrick about just putting 15 minutes in. If you commit to doing something for 15 minutes, a funny thing happens. You don't do it for 15 minutes, but you've broken the ceiling that stops you from putting that first minute in. So you say, I'm going to do it for 15 minutes. After 15 minutes, I can walk away and all good. Once you start, you're probably fine. So then we move into the action stage where a person's actually doing something about the change. And here we're changing the treatment plan as we go, the plan that's been made, the change plan, I should say. What skills does that person need? They're changing something. So there's a new skill set that needs to be acquired. Who are the supports? Who are the people that can help them through this change process? Cognitive behavioral interventions. There's a whole other video on the Rutgers channel and on my channel about that, how you can do that. If you're familiar with illness management and recovery, that does a lot of cognitive behavioral work as well. The other thing I would say about the action stages, to be on the lookout for unintended consequences of a positive change. 2 weeks ago, we gave the example of, well, if you join a gym, okay, that's a positive thing. Where's the negative in that? Well, it costs money, and where does the time come from? And if you have other responsibilities during that time commitment, what are you going to do with those? Childcare, another job, something else fun that you were doing, whatever else. There's always a negative, even to a positive change, there's always a negative aspect to that. So what are you going to do when that shows up? And those are really hard to predict. It's hard to predict the negative side effects, as it were, of a positive change. And then maintenance, which we defined as when change gets easier, whether or not it's 6 months. Planning the new changes. What's the next step? Let's keep the improvement working forward. The 12th step, helping someone else with the same thing. That keeps you in touch with your own stuff while also helping someone else. And then continuing to expand that social support. So most people are in these pre-action stages, pre-contemplation and contemplation. And unfortunately, 90% of our interventions are set for people that are in the action stage. So we start out in front, and that's why our interventions are here. The person's here, and that's very often why things fail if we don't change things on the fly. The other major point from week 1 was the stages of change as a process and how crucial it is to have that written plan to refer back to when relapse happens. And we assume that relapse is always going to happen, or recycling, as they call it. Very often it's back to pre-contemplation, or I'm sorry, back to contemplation. That didn't work, so now I'm stopping. And that's not what we want. What we want to do is direct that person back to the plan. Okay, how did this plan not account for what happened? And how can we change and improve the plan? If that is the only trick that you take from this whole thing, that's a win, because then you're not in this process of starting over. You're always building from where you are. And a relapse or recycle can be a good thing if a lesson is learned from it. Sometimes it validates why you made the change in the first place. So that's the big part of this process part of it, so that we can keep that person moving forward. Change is messy. It's 1 step forward and 2 steps back by definition. And if you think about the changes you've made in your own life, I'm sure it fits into that mold as well. Very few people have a quick, they just make a change and that's it, and they go forward. Usually there's this sort of messy, we have to fail forward or learn how to succeed through repeated attempts, and that's okay. And that's why persistence is so important. So the last piece of review, and I had just found this, and I really like this. The source is at the bottom, and all of the black type on here is mine, but the rest of it comes from the actual slide. And I love this look as an overall map of the stages of change, starting with pre-contemplation, going from left to right. And then the interventions become more further on in the stages of change as we go down. So it starts out with analyzing defenses, looking at what choices that person has. That person probably has more choices available to them than they know. Reevaluating their image. Where does this problem behavior cause dissonance for them in how they view themselves? What is the impact of their behavior on other people around them? They might not care what happens to them, but they do care what happens to people around them, particularly their loved ones. Then as we move into contemplation, going public and enlisting support. And then you'll notice down the left-hand side, we go from cognitive and affective processes, changing how the person feels and thinks. That's at the core before we can move into behaviors. And again, very often we jump right into changing behaviors. But if you haven't changed the underlying, this is very CBT, if you haven't changed the underlying thoughts and feelings, it's a Band-Aid. You're not getting at what's really underneath. And so that's why when someone's there, they haven't done that work yet to get to the point of a behavioral change. And then we jump in and try to get them to change behavior. I've done this a thousand times. Then we get to the behavior change. They commit to making the change and what change they're going to make. And we'll talk more about that in the motivational interviewing stuff. How do we remove triggers from their environment to make their environment safer for this change to take place? How do they develop more helping relationships? How do they expand their social network? We gave the example of the recovering addict realizing that, all right, I can't hang out with my old friends anymore. I have to make a new group of friends. And very often that group of friends starts out in a meeting, meeting other people in recovery. And last but not least is what's the reward? What's the reward? What's the acknowledgement, the validation that that person is going to give themselves to keep this change going on? Because change is a lifelong process. I think that we are very guilty of, and I know I am, of treating change as if it is a sprint, and it's really a marathon. If you want to see permanent benefits in your life, then the change itself needs to be permanent. That's sort of the downfall of a diet. I'm going to do something temporary, and it's going to have long-lasting, lifelong rewards. All right, so you probably remember this from last week. This is the payoff matrix. I know this has been sent out, so hopefully you can have access to this. And they're also available online. I just made one on my own. So the payoff matrix, you see this 2x2. It's in the top left, it's the benefits of change. What's going to change for the positive as a result of this change? Top right, the benefits of not changing. What do you get from not making this change, from staying the way things are? Bottom left, the consequences of change. These are these tricky things that may come around negatively, as I was just mentioning about the gym, that come from this positive change, and then the consequences of not changing. If I keep going the way I'm going, or if things get worse, what's the end result? And my favorite way to do this form with clients is to have them put something in each box and then to circle the most important element in each box. That tells me what the primary driver of change is and what the primary driver of staying the same is. So that's why I'm a huge fan of this form. And use it on myself too, take that nice long critical look at my own motivations. So the tools of motivational interviewing, as we talked about, are comprised of OARS, open-ended questions, affirmations, reflections, and summaries. Open-ended questions, as we mentioned, a closed-ended question is a question that can be answered with a yes or a no or a specific piece of information like your name or your address. And what we're looking for is, wherever possible, we want to throw that scope wide open so that people can give us more than what we're just asking for. If we just ask for these bits and pieces of information, that's all we're going to get. Very often, all that other information can give us more than what we were looking for, and can give us a lot more insight. So we reviewed this. Affirmations is basically praise. Particularly at the beginning of a relationship, it's the best way to reinforce that relationship. And your goal is not only just to compliment the person, what you see them doing on a day-to-day, but to be able to spot characteristics within themselves, enduring characteristics within themselves. They may not have been giving themselves full credit for these things. So now you get to give them credit for these things. So how are they going to help? You're helping them to notice these things within themselves. And then even better, if you can If you can call attention to the target behavior, if their target behavior has to do with their hygiene, and you notice when they have good days, that's a really powerful reinforcer. And it doesn't require a lot of effort on your part, but it does require being aware and noticing. And if you remember the little rant about this from a week ago, the only rule is it can't be a backhanded compliment. It can't be sarcastic. And I know we have some sarcastic people out here. In New Jersey, we have lots of sarcastic people, but I'm sure we don't have a monopoly on it. So the trickiest skill, I think, of motivational interviewing, apart from withholding all of my great advice and great ideas and experience and education and all that stuff, that's usually the big battle for me, is just shutting up and letting the person talk. The other one is the reflection. This is the hardest one to teach. How do we convey meaning and show the other person that we not only heard the words that they said, but we also understand the meaning that they said? That's the whole point of communication, is imparting meaning. And if something isn't said properly, as shown by number 1, if it isn't heard properly, as shown by number 2, or if the words mean something different to the listener than to the speaker, and that's number 3, then the meaning gets lost. And the job of reflection is to close that circle. Okay. Oh, and just to reinforce a note for some people who came in later, if you didn't get any of these materials, Miss Castle should have access to the recordings from these sessions. She should have all of the slide decks from these sessions and the handout materials. If you don't have them, you can email me and I'll send them out. My email was on the title slide and I put it in the Q&A. So sorry about that sidestep, but I didn't want to forget it. So reflections are statements. So just like we want to minimize closed-ended questions and switch them out for open-ended questions, I think probably the most critical tool is this being able to say someone's words back to them, either as they said them to you or with some interpretation. So interpretation allows you to do hypothesis testing or to check out different parts of what that person is saying to you. So while we're sitting back listening and not giving all this great advice and direction, this is what we're doing. We're sitting back and finding the places in what they're saying that we're going to ask about later. And in the meantime, we're sending back to them what they say so that they know they were heard and so that they can keep going. You're eliciting instead of telling. So just to review the reflections, it's a statement. So it doesn't have that upwards inflection at the end, like I just did. And you take all of the question words out. Make a statement as if you knew it were right. Even if you're wrong, the person's going to correct you. They want you to get it. They want you to understand. So it's not like, oh, I reflected and I was wrong. I said the person was angry and they said, no, I'm really sad. That's okay. You don't take any damage for that. You're trying to get it, and that's where the value is. And sometimes that person can actually, that can be deliberately missing, is a type of reflection, as we'll see, so that the person will then get you to where their truth is, because that's where you want to be. So as we mentioned before, these are not going to work coming out of your mouth necessarily. I invite you to start with them and then find what works for you. It may not work where you work with your population. I don't know if you work with kids or if you work with seniors or if you work in a certain area. This may not work. My guess is start with these and then find what works for you. You'll find your own way of bringing this information across. If these work for you, that's great. But so simple reflections, again, are just giving people back what they said to you. So repetition is saying it exactly back the way you got it. So they can hear their own words coming from you. There's a point to that. Again, can you go through a whole 45-minute session just repeating back so it sounds like Echo Canyon? No, not such a great idea. But it's very powerful in places, especially if somebody says something that strikes you or is very controversial or weird, or I don't mean weird, but just outside of your understanding. That's a really good thing to say back, because you want to make sure that they express themselves accurately. They may want to change it, or they may be a little stunned by what they said to you, and it may be the truth. Rephrasing is where you interpret, you make it your way, and you mindfully and deliberately change what they say into your own words so that they have to process what they said in your words. So those are the simple reflections. Getting into the complex reflections, and again, this is probably beyond where we are right now in an intro, but it's worth following up on. These are very valuable tools in communicating. If you're reflecting content, all you're doing is saying back to them what they said with no emotion in it, just the facts. If it's reflecting feeling, it's the opposite. You're just reflecting the emotion and you're disregarding the data altogether. You just say you sound really excited, just emotion, as opposed to you're graduating. Sounds like you're graduating in the summer. Okay. So that's between just content and feeling. Reflecting meaning is when you can catch both. How do you catch both content and feeling at the same time? And hopefully take that to sort of a deeper level. I think my favorite reflection, as I ranted about last time, was the double-sided reflection. I love when you catch both sides of an argument. It sounds like you want to eat healthier, but you're concerned about the expense of organic food. It sounds like you want to try taking this medication, but you've had a really bad experience with medication in the past, and so that's making you a little reluctant. You've caught both sides of the argument. And again, I feel a necessary step before you can help a person. You can't ever really walk a mile in their shoes, but by expressing that, if you've nailed a double-sided reflection with somebody, you've shown that you've at least put yourself in the position where that person is, at least in your mind. So that helps you. First we understand, then we work on the change process. And then this amplified reflection, being retired is the best thing ever happened to you. Amplified is shooting too far deliberately, making a deliberate mistake or overstatement in a reflection so that the person corrects you. Or maybe they don't correct you. And now summaries, as we mentioned before, summaries is a nice way to end a session. Let me make sure I got all this right. Boom, boom, boom. Quick, concise summary of what they said to you. So you can either end the session, but showing that you've heard the person. You can use all that information to then link and go somewhere else with it and say, hey, I heard you say something like this before. This is different from the kind of stuff you were saying when you first came in. So it allows you to highlight what that person's saying and compare it to something they've said in the past. And the last one enables you to transition. So if a person's gone kind of off the beaten path and you want to get them back to the topic, then you can do that. Or transition. My guess is that all of you are in a big time crunch and you're thinking, oh my God, how am I going to do all this stuff and sit there and listen when I have these things that I need to do? And this is one of the ways, if a person is taking you sort of far afield, you can bring them back again. You said something before that I want to get back to, or I just remembered something that I was supposed to ask you today that I didn't, and you use the summary as a way of getting that going. And here is your OARS cheat sheet. So here's your open-ended question, your affirmations, your reflections, and your summaries. You're welcome to use this as an aid to you when you want to practice this, working with your clients, or if you have somebody you want to test this on. They encouraged us to do this with family members first, to do a complete OARS conversation with a family member before trying it out at work. So you're welcome to try this, or my other trick was I wrote OARS in the margin of every note sheet that I had so that I would remember to do all of these things while I went. All right, so we are going to transition into change talk and sustain talk, the main subject for the day. Okay, and you know what I'll do? I'm looking over the questions and answers. I will go back to the title slide and put my email out there, but it's ken.kinter@rutgers.edu, ken.kinter@rutgers.edu, but I'll go back to the title slide at the end so that you can see it. And I answered somebody's question with it before. So change talk and sustain talk. Motivational interviewing has elements that make it look like a science when you start counting different responses, but there's also a part of it that's the art of it. And I think the most obvious example of the art of it is a big part of the art of motivational interviewing is calling attention to change talk and kind of disregarding or ignoring sustain talk. This is one of the ways that you very subtly guide but do not direct the conversation. A person can give you a whole paragraph about why they can't make this change, but if they give you one sentence about how they would like to change it, that's what you call attention to. You know, it's, I guess, like the old song says, accentuate the positive. I don't know if anybody goes back that far. I barely go back that far. So accentuate the positive and then let that sustained talk go, the negative self-talk that they tell themselves. And we all have. So change talk is any client speech that favors movement in the direction of change. So anything, and we'll talk about in detail all of the different types. And that's compared to sustained talk, which is any talk that's about maintaining the status quo. And we'll review that. So there are different types of change talk, and it's very helpful to be able to differentiate between them. There's a big difference between saying I'll pick the example of weight because that's a big one for me. I would like to be able to lose 10 pounds. I can lose 10 pounds. If I lose 10 pounds, then maybe I go down a clothing size. I need to lose 10 pounds because my doctor told me I need to. So you hear the difference between those different types of change. It's the same change, but the type of change talk that you hear from someone makes a big difference and tells you where to proceed next. Just like stages of change. Once you've assessed where that person is, you know the intervention to use. And the same thing with change talk. The type that you're hearing and not hearing is pretty critical. And we're going to play with this in detail because we're going to have some time. So I hope you have a pen and paper handy, or at least something you can keep a little score on, because we're going to get to that in a little bit. So this part of change talk is referred to as DARN because MI loves their acronyms. So one type of change talk is desire, and that the verbs tell you what type of change talk it is. I want, I like, I wish. So those verbs express desire. Second one is ability. I can, I could. So it's about your ability to make that change. So that's the ability, the A. Reason is a little trickier. Reason is almost about the secondary gains of change, not about the change itself. So the example I gave before was, I'd like to move down a clothing size. Now, I don't want to do anything. I want to have that happen magically, but I realize there might be something I have to do to actually make that happen. So an example that I give that I think is a little better, and I'm open to other examples, is I'm sure many of you want a higher paying job. And perhaps that higher paying job requires a degree or a certification or something like that. So you might not want that degree or that certification, but what you do want is that job, or more specifically, the increased money that comes with that job, right? So reason has to do with, this is the way I have to go do this thing. So it's almost like a middleman. If I go back to school, if I get this degree, if I get the certification, then I get this thing that I want. If there was another way, I would do it, but that's what I've got. So the reason is captured by, if I do this, then this thing I want will happen. Just to give a couple other examples, if I take this medication and follow up with treatment planning, then there's a better chance I'll get discharged from the hospital. If I stop using, then I might be able to get my children back. There's a lot of different, but the trick is they don't really want the first part. They want the second part. So it's a trade-off. So we'll review that a little bit more. Then there's a need to change. I need to, I have to, I got to. This is a result of pressure, something that you have to do. And you either feel like you have to do it internally, or you feel like you have to do it, you're getting pressure from outside. For, again, a doctor telling you need to do something, or your spouse telling you need to do something, or your boss telling you need to do something. You don't want it, but it's kind of, I don't want to say being forced upon you, but there's pressure involved. Now, interestingly, just because someone's making these statements, these are a part of the change process, but it doesn't really correlate to change by itself. The research hasn't backed that up. What it does lead to is CAT. And yes, motivational interviewing uses darn CAT as an acronym. which I think is kind of cute. So darn cat. So once they've gone through the darn, now they move into this stage. Commitment language. I will, I promise, I give you my word. Activation language, which is not quite as strong as commitment language. I'm thinking about it, I'm considering it, I'm willing to do this. There's like a negotiation going. And then the T in darn cat is taking steps. So, and this is something I probably could have talked about a little more in stages of change. And you guys asked a great question about this. Part of you asked a great question about what if somebody's telling you all the right things. It sounds like they're further along in their stage of change, but they're not doing anything. And what happens is they're just it's probably a sign of pre-contemplation. They're just talking to you about this just to get you off the scent. They're not taking any action. So they're just telling you what you want to hear, which unfortunately our system fosters a lot of that. I work in an involuntary treatment facility, and there's a lot of that happens. So that might not look like pre-contemplation, but if there's no action being taken, then it probably is. That person's trying to change you. They're not trying to change themselves. So the other issue is about this taking steps piece. In preparation, people can take preparatory steps to change, but they haven't made the change yet. So they can, my favorite example of this is my friend and I were both trying to get in better shape. So here's what we did. I joined a gym and then never went again. And then they were sending me emails and things like, apparently you have to go back. I don't know. I went once, I paid the bill, leave me alone, you know? And I hope you're having a laugh at my expense. And then my best friend went to a sporting goods store and bought running shoes and all this sporting goods stuff. He had a trunk full of athletic equipment that got about as much use as my gym membership. So he's sitting here with a trunk full of stuff. I'm sitting here with a gym membership I'm paying for and not going to. And you can probably guess how the rest of our change initiative went at that point. It did. So taking steps is actually not action. It's preparation. It's setting the stage for change. It's a good thing. It's a good thing. But again, what we don't want to do is get out in front of it. So taking steps, those preparatory steps. Bought the shoes, got rid of the alcohol in the house. I'm getting ready to do this thing. But of course, we can get ready to do this thing and not, you know. I'm guessing that we all probably have examples in our own lives of where we were all gung ho and all ready to make this change. I'm going to eat healthy. I've got a fridge full of healthy stuff, and I'm going to stop at McDonald's on the way home just because that's how we're going to do it. So here are some statements about change, and think about these in terms of darn cat and what we just talked about. So the statement, I think I could quit. Could. Could is what sort of verb? What does that sound like? You know, if we were going to go back, could. So we see could here under ability, and yes, you can cheat and look at those and decide what it's going to be. So could is about ability. So that is a statement about the ability to change. I have to do something about my drinking. Have to. What does that sound like? All right, we've got that under need. So that means the pressure, the person they feel pressure to stop drinking. I want to recover from my illness. Want to. What does that sound like? Hopefully that's an easy one. I'm not even going to go back for it. That's desire. All right, let's get a little trickier here. I want to get my kids back, and I can't do that unless I quit drinking. All right, so this one, wait a minute, I see want to right in there. So that means it's desire, right? So let's see. I want to get my kids back, and I can't do that unless I quit drinking. So there's our want to, it's desire, right? Or does it sound more like something else? And the question is, does this person really want to quit drinking? Or do they just want to get their kids back? If they could get their kids back without drinking, without stopping drinking, would they? And it sounds like they would. So this is an example of that reason. I don't want the thing, but I want this other thing, and this is how I'm going to get there. I'd like to have better control of my drinking. Like to. And that sounds more like desire again, right? All right, now let's move on. I'm going to stop using. Going to. All right, is that desire? No. Ability? No. Reason? No. Need? No. Let's scoot back a little bit. Commitment, activation, taking steps. It sounds like commitment. I'm going to stop using. I'm thinking about becoming a vegetarian. All right, what does that sound like? Thinking about. So it's not quite commitment, thinking about it. That's activation language. And what do we have here? And I told my friends I'm not getting high with them anymore. All right, so what's that sound like? And what that sounds like to me is taking steps. This person has done something. So this illustrates that point where, is this really part of the change initiative? Maybe it is, and maybe it isn't. But it's a preparatory step. It's probably a necessary step. It's not making the change in and of itself, but it's setting up the change. All right, so I'm going to take a minute, look at the Q&A, and then we are going to play with the darn and see how it works for each of us. All right, yeah, it's about the emails and things like that. Okay. So if you have any questions, you can drop them in the Q&A. I'll check that at least one more time before we wrap today, probably twice. All right, so here's what I want you to do. And this is going to be a little weird because we're not interacting so much, but we can still do it. So I want you to think about a behavior that you want to change about yourself. And you're not going to tell anybody what this is. So this is completely confidential. So I challenge you to be honest and think about something about yourself that you are really debating changing. You don't have to write it down and you don't have to say it and you don't have to tell anybody. You just keep it right up here where you need it. But here's what we're going to do. In fact, I'm going to ask you these 4 questions and we're going to get 4 scores out of you. And I want you to put your numbers in the Q&A. So you'll have 4 numbers, 1 for each question in each of these boxes. But in the meantime, just write down or just remember what that number is so that you can capture it later on. All right. So hopefully you have your behavior picked out, the thing it is that you're contemplating changing. So let's answer these 4 questions. So on a scale of 1 to 10, where 1 is the least and 10 is the most, how much would you say you want to change this thing? How much do you want to? 10 is the absolute most, 1 is the absolute least. And we're just measuring your desire to change this thing. Next up, on a scale of 1 to 10, where 1 is impossible and 10 is extremely possible, how much would you say you can change this thing? So 10 is, this is easy. I could change this anytime I want. 1 is, it's next to impossible. It's absolutely next to impossible. So what's your score for this particular behavior that we're talking about? So you should have 2 numbers in your head right now, desire and ability. All right, let's keep it moving. So on a scale of 1 to 10, where 1 is not much and 10 is a lot, how much would you say change would help you in some other way? For example, I don't want to lose weight, but I don't want to buy new clothes. Or I like smoking pot, but I'm tired of losing jobs and getting arrested. And boy, that example's dated. I'm going to have to change that one. We'll change it to some other drug, right? All right. So 10 is that these other reasons are supremely important, and 1 means that they're not important at all. So 10 is the most and 1 is the least. So hopefully you've got 3 numbers in your head now. And last but not least, on a scale of 1 to 10, where 1 is not much and 10 is a lot, how much would you say you need to change this due to pressure from yourself or others? So this is where either someone else is pressuring you, you need to change this, or you're just telling yourself, I got to do this, man. I have to. I can't not do this anymore. So you should have 4 numbers in your head now. And what I'm going to ask you to do is put those numbers in order in the Q&A. I'm going to give them a quick look, and then we're going to review. I'll give you a couple minutes to do that, and then we'll get started. And I'm going to cheat and take a look and see what people are putting in right now. Yep, I see isolated scores coming in. Now I see four scores coming in. Yep. Yep, here we go. So something else to think about before we get started on interpreting these scores, and this is something I've been doing because I've been playing with these in trainings for so long now. Think to yourself, because you see the questions underneath the boxes, why is it that number and not a lower number? It's a real interesting question to ask yourself. If the score you gave for a given item was a 5, well, why is it a 5 and not a 4? And the other interesting question is, what would make it a 6? What would have to happen in your life to make it a 6? So it's kind of validating why you gave the score, but also, again, we're weighing what's on both sides of change. How come it's a 5 and not a 4? And what would it take? What would have to happen to make it a 6? All right. So let's get started and let's play with this a little bit. You got your 4 numbers. Now, when I do this with clients, and this is exactly how I do it with them, the score to me that's most important is your lowest score. Your lowest score, I call it your anchor score. Your anchor score is the reason you have not made the change yet. You could be 10, 5, 10, 10. That 5 is what's getting you. And if I'm going to work with you regarding making a change, we got to see what we can do about that 5. I got to figure out why it is a 5 and not a 4, why it's a 5 and not a 6, and what would have to happen to move that 5 up. Because if your numbers are 8, 9, and 10, you're ready to go. You're ready to change this thing. If your numbers are 1, 2, and 3, you're just plain not interested. You're not interested in changing this thing. So, I would put my effort somewhere else. There's probably something else that you'd have a higher score about. So a couple of things that I've noticed, and I haven't scrolled through all of the Q&A to see them. You tell me if this is true for you. A couple things. First of all, the lowest score for most people tends to be ability. Ability tends to be the lowest score. And why I think that is I think that the largest barrier to change is that we don't think we're going to succeed. And we don't want to beat ourselves up after we fail again. So our ability to make change, or our perceived lack of ability, is what holds us back. The other thing that I would notice is that in the darn, your first number and your last number, the D and the N, one tends to be high, one tends to be low. They tend not to both be high together. And I could look at the scores to see how full of nonsense I am about that. But usually that's the case, which means if you desire something, there isn't that much pressure. If there's a lot of pressure, it's hard to want that change. And that's another piece where sometimes we defeat change by adding pressure to it. So let me give you an example. I did this in a training, and a woman mentioned she had a desire of 1 to change this thing, but her need was at 10. Now that's pretty extreme. But I mean, literally both extremes. Now, I had already made a promise to not ask what the thing was she wanted to change. So I had to keep that promise. And while I was in the front of the room trying to ask her questions, but keep the promise, I said, so let me ask you a question. So your desire is 1 and your need is 10. If the need backed off a little bit, if it backed off to an 8, is it possible the desire might pick up and move off of 1? Are you getting so much pressure about this that you don't have any desire to change this thing? So while I was waffling and trying to figure all this out, she said, my husband thinks I'm fat. And I went, that's a dead man walking right there. But in a serious way, in our desire to make someone change, we add all this pressure. And again, just like we were saying before, it builds resistance. And we may overshadow that person's own desire to change that thing in the first place. Now it's just something else I have to do. Did you ever have something in your life that you really liked to do and really enjoyed doing until you had to do it all the time, and then all the pleasure just got completely drained out of it? And that's kind of what we're talking about here. All right, so enough for that tangent. Let's get back to these scores. So point number 1, your low score is your anchor score. How do we get that score up? Because that's how we facilitate change. The next thing is, once you've identified the anchor score for a client, which score is their anchor score tells you a lot about where to go next. So let's just do it in order. So for those of you out there, if your desire score was your low score, or tied for your low score. Here would be the interventions. So if someone's desire score was lowest, I would say to them, I would want them to research more about this change. I want them to look into it more and find more things to like about the change. Maybe they just haven't researched it out so much. What is it about that? Maybe that whole the payoff matrix might be a place to go next with that, and have them look at, all right, here are all the good things about change. Here are the good things about staying the same, bad things about change. Let's research it a little more. To me, this is about information gathering. Let's find more reasons to like this change. If ability is the low score, which again, my experience is that it is most often that's the case, as high as 2/3 of the time, there are two strategies that I use. Maybe three. One is I want to build on that person's past successes. They don't think they're going to be successful, therefore they don't try. So I want to point out all the things that they've succeeded at in the past so that I can use that as evidence against that. Another one is just to build that person up in general. They probably got some negative self-talk going on. It's probably somebody who tells themselves they're not going to succeed, they're going to fail again, and we want to counter that. And the other one is maybe we should rotate down the loftiness of the goal. So I gave the example before about losing 30 pounds as opposed to losing 5. How do we scale down the goal? We still have the ultimate goal in the same place, but what if we just break the steps down a little bit? Instead of cleaning the whole house, let's just clean one room. Instead of quitting smoking for the rest of your life, why don't we just quit smoking for today? I mean, isn't that like basically one of the major foundational principles of Alcoholics Anonymous is don't worry about tomorrow. Let's get today right. If you can go 24 hours without doing this thing, that's all you need to be able to know how to do. So again, build up the person, past successes, and maybe scale down the size of the goal. I actually got an email from one of you that I answered where, what do we do when our clients express these wildly unrealistic goals? And we don't want to be the person to say that they can't accomplish something. But when we look at all of the steps that are involved, can they do that? Can this person become a Marine or become president if that was the goal that they've stated? Well, let's look at each of those steps and see how willing they are to take all of those things on. Or what is it about that thing that they like? And can they get that thing some other way? Speaking of that, let's move on to reason. So if reason was your low score, this means that you're trying to find another way. You're not completely convinced that this is what you need to do. You want that long-term goal, but those secondary gains aren't really there. So how can I make more money without going back to school? I don't really want to go back to school and spend all that time and do all that stuff. Is there some other way? And if this score is low, you are still looking for that other way. You're not committed to taking this path. And maybe there is a different path. Maybe there is. So those other secondary gains aren't so strong. Another intervention might be, what are these other secondary gains? Let's flesh that part out a little bit more. All right. And then the last one, if your need score was low, that means that there is a lack of pressure either from within or without. You don't have to make this change. So if you don't have to, then why do it? That's kind of where this argument goes. And again, this tends to be inverse from desire. Now, anecdotally, one thing I've noticed from doing these trainings is probably everybody in this virtual room is a helper, right? We help other people change. We help other people. Very often, that means that we don't help ourselves very much. Very often, we are not the receivers of help. We are the givers of help. And I've had to learn that lesson the hard way in the last year about receiving help. So we are always there to help other people change and to help them move along. But who's there to help us move along? Where are our supports in our change process? Is it possible that we're so busy being a support and a good change agent to other people that we are not doing the same for ourselves? Tough question, right? So if this is the low score, then where is that? Where is that support to help you make that change? Or is it going to have to get to the point where it's a cop or a boss or a doctor who's telling you, okay, you need to do this thing now? Where is that person? So that is my guess, is that's what I've learned about these scores. And then this is how I use whatever that person's anchor score is to go forward and investigate that a little bit more. I hate to say that's the only score I care about, but that's the primary score that I care about to help move that person through the change process. All right, if there's any questions about that, fire away. I'm looking through all the scores. Oh yeah, I see some. I see some low ability scores. You guys are making me look smart. And then there's some where it's the highest score. So there's that. And then some are flat. It doesn't matter what they add up to altogether. I see some people tallying all 4 scores up. I mean, that's nice, the higher the score is, but my primary concern is what's the low? Oh yeah. So I see one that's 1133. This person really doesn't want to change this thing. I wouldn't even give it any more energy. My guess is there's probably some other change that would probably have higher scores somewhere. All tens. That one's interesting. Oh man, I would love to work with somebody with all tens and find out why the change hasn't happened yet. If I had to make a guess, I would say there's something outside that person's control that's just, making that change impossible. Lots of tens, lots of people ready to change here. Neat, neat, neat. You guys would be really interesting to work with, especially all these all tens. How come an all 10 hasn't happened yet? All right, great question. So that the question I brought up about why is it a 5 and not a 4 or a 6? That person may say, because I feel there's so many variables that I don't know enough about. Well, then our change process going forward is to find out about all those variables, particularly the variables that we can control. Let's see. All right, just looking to see if there's any other questions on there. Looks pretty cool. Be an interesting group to work with. I'm kind of bummed I don't get to follow up on these things. But what I encourage you to do is use this as a model for yourself. If you can use this tool for yourself, you can definitely use it with other people, and then you have your own experience to draw from. So I would ask you to continue with this and say, why is it that number? Not why higher, not lower? What do I do to move it up? And a great question I don't have an answer to is, what happens when all of these are 10 and the change still hasn't happened? That's a great question. And my guess is it's because there's some outside force that just stops this, or we just have to recheck the scores. That might be another solution. So I mentioned before, the sustained talk is any talk, just like there's darn cat for change. This is the darn cat for sustain. Desire to keep things the same, inability to change, the reason why things need to be the way they are, the need for things to stay the way they are. For every type of change talk, there's a sustained talk. It's basically, as we said in the beginning, there's 2 sides of the same coin. And if you listen to a client's conversation, like if you were able to just remove yourself and just hear what they said, like if you were listening to a recording, it's almost like a pendulum that goes back and forth. A person does a little bit of change talk and then sustained talk, change talk and sustained talk. And you just want to kind of work that pendulum more over into the change side. Again, you're not being the cheerleader for change. You're letting them lead. You're following them in this area. And, oh, could you tell me more about that? You mentioned that you'd stopped smoking in the past for 6 months. Tell me about how that went. So you're following that up. This is another ruler that they use in motivational interviewing. I have not gotten nearly the use out of this as I have the darn ruler, but I did want to make it, I did want to tell you about it. It works the exact same way. In fact, if you wanted to do this for the behavior that you were just talking about, I welcome you to do this. And how it works is, it's the ICR ruler, which stands for importance, confidence, and readiness. So same deal. On a scale of 1 to 10, where 1 is the least and 10 is the most, how important is it for you to change this? Same deal with why it's that number and not a lower or higher number. Same deal with confidence, and then the same deal with readiness. This is a tool that gets used when that person is a little closer to the edge of actually making a change initiative. So this one you use a little later. Darn, you would use earlier on when you're just sort of assessing where someone is. This is when they're pretty much ready to go. Like, okay, are we going to do this now? Or is this something that we still have to plan for to leave preparation and go into action? So how do you know when someone is ready to change? That's a great question, right? So hopefully now you got a much sharper ear for change talk, for hearing these darn cats. And again, if you're taking notes on somebody, I label those. Up they made a desire statement, or up they made a sustained talk statement about their ability. I'm trying to see where they are, in their perception of change. So you're going to hear more change talk and less sustained talk as this person is getting ready. The talk and the affect has to precede the action. Very few people just do without any of that other stuff behind them. And when they do, it tends to not last. The person becomes at peace with the idea that they're going to change. Um, all of the fear of the unknown starts to diminish because this person knows they're going to move forward into whatever it is. I mentioned before, one of the things I loved about crisis is when someone said, I know I can't do what I was doing before. I know I have to do something different and I don't care what it is. And that's actually, it's a scary place, but it's a good place. Envisioning change, that great question of what would your life be like without this thing? Can you picture what your life would be like, without the addiction in it, without the mental illness in it, without this problem that you're dealing with, or even just having it in a better place? They start asking specific informational questions about how to make this change. Like, okay, how do we deal with this? So they start to get into the nuts and bolts questions. And then, as we mentioned before, taking small steps or small actions in the direction of change. So I have spoken at great length, and probably at too much great length, about being able to withhold advice. It's one of the hardest things to do, is to not just jump in and fix. As someone who's worked in this field for a long time, I was a fixer before I got to this field, if I was going to be honest. I always wanted to help people. And the shadow side of that is, I always felt like if I heard someone's problems, I could come up with a solution. And there's a sort of an arrogance in there, right? Like, okay, I know how to live your life better than you do, which is pretty brave to say. Instead, this has you hold all that stuff back, where you would be putting in your advice and your direction and your experience and your education. Because again, you've worked with many people who are in a similar place to where this person is that you're working in front of you, and you want to impart that information. There's just a time and a place in the process. And it's not right off the bat when the person is in maximum distress, when we have minimal relationship with that person, and we haven't had any successes yet. It's the worst possible time to jump out in the beginning. But motivational interviewing does allow for people to give your advice and share. And to me, the best way to do that is by asking first. And asking permission is a little strong. Usually what I like to say is something like, hey, I worked with someone else that had a very similar situation to yours, and there was something that really helped them out. Would you like to hear about it? And their nonverbal answer is more important than their verbal answer. Any of you have adolescent children and you try to tell them something and the eyes start to roll before you start talking? Do you keep talking? There's an argument where maybe you shouldn't, because you already know that person isn't listening. So stop. So kind of the same thing here. If you get the verbal or certainly the nonverbal, um, they're just not ready to hear it yet. Maybe with time and with the relationship developing a little bit, maybe a success or two along the way, they will be ready to. But there's nothing wrong with asking. And it is a sign of respect. You're respecting the client by saying, look, I've got something, but it's up to you. You're supporting that person's autonomy. They're the ones that make the decision. It's their life at the end of the day. Our job is just to offer choices and say, hey, these are the options that are available to you. Which one do you think is going to get you to where you want to go? The other strategy is chunking, and that is just being able to give one piece of advice or one piece of information and not running on and on with it. Just put one out there and see how it works. And before going out with the second and going with the third and hoping they take one. I guess sort of the less is more strategy. One specific thing, see if they do that, and then you can go on to the next one, as opposed to here's a list of things you can do that they may not do. So this is an exercise I would usually do with you guys, but this is a tough one to do in a non-interactive setting. But maybe let's take a swing at it. And then I think we're going to be able to wrap, and we should be able to wrap a little early because we got through the material quickly. So the scenario is, so I want you to think about what your answer, what your response would be, and you can put this in the Q&A as well. So here's my scenario, and it's also autobiographical. So full disclosure, this is basically me. I am the world's worst vegetarian. I love animals, have several rescue animals, but have failed to become a vegetarian at least 100 occasions. I can go about 3 days without eating meat, and then I go back again. I want to stop eating meat for spiritual and nutritional reasons. It also helps financially. I'm also aware of the health value of it. My wife is a vegetarian, so it's easy to go meatless at home, but anytime we go out, I'm very tempted. After I relapse, I feel bad about myself. I just got blood work back, and I'm on medication now for my cholesterol, so it's starting to impact other areas of my life. All right, so let's take the time out right here. It's okay if the first thing that you wanted to do was jump in and fix. It's okay. It's all right that you want to do that. That's altruistic. You're trying to help me. That's a good thing. But that's not where we're at here. So if you're going to say, oh, well, you could do this, So think about this for yourself. From all the stuff that we've learned over these last couple sessions, what can we do here? So first, let's look at stage of change. All right. So, okay, does this person admit that this is a problem? Looks like it. Looks like it. So are we at the point where this person they want to change, but there's other reasons going on? Sounds pretty clear, right? Sounds like some contemplation going on here. There's no plan. There have been past actions, but not current. So we know there's been some relapse. This person, me, has gone through this loop a bunch of times, back and forth and back and forth. So the person is in contemplation, and you can see so if we were talking stage of change, it's contemplation. So we know from week 1 that what we try to do is we try to provide information, look at what's on both sides. What are the reasons for change? What are the reasons against change? And there's a bunch of them in here. This person expresses wanting to stop eating meat for a variety of reasons. There's all sorts of reasons to change. But we also know that there's always a relapse. There's always a going back, usually at around the 3-day mark. So that's a helpful piece of information too. All right. So we get this person in there now, and I'm sure that the clients you're working with, their biggest issue is not that they're trying to become a vegetarian, but just trying to use this as an example. So what do we do with this person? Now, think about the handouts that we've used. You would have a discussion with this person about their desire to change, their ability to change, their reason to change, their need to change, as well as commitment speech, activation speech, and taking steps. You would want to assess where this person is. My guess is that this person has not had any sort of written change plan. They just did it. And you already know some of the contingencies that led to this person relapsing. They go out, and it tends to be about 3 days. So you can use all this to ascertain where this person's at in the stage of change. And then after you figure out where all those things are, then we can start to move forward into, okay, what are you willing to do? What are you not willing to do? So take a minute and think about this. What sort of, and then using the tools of motivational interviewing, what sort of open-ended questions would you ask this person? What sort of affirmations would you give this person? What sort of reflections, what of what I've said here would you reflect back? And there are a lot of different directions to go in. But the most important part is what's the direction that the person is ready to go in. And just to give you a few examples of where this has gone in live trainings, because I've been getting some help for this, some of the discussion came up around going out to eat. If going out to eat is the big thing, should that be what gets addressed? I've also had people say to me, maybe you really don't want to be a vegetarian. Maybe you want to eat less meat, and maybe the all or nothing approach isn't for you. Maybe eating meat once every 3 days is where you want to be, or at least it's a step to where you want to be. Maybe that is the plan. Do 3 days, eat meat once, and then go back to it. And put it in a written plan so that way you know when you're on course and when you're not, so you don't just stop and give up. So there are 100 different directions to go with this person. What I would like you to be able to do, my hope is that after we've spent this time together, that you are able to, one, assess what stage of change that I'm at for this thing, which I think is pretty clear here, and to be able to use those tools and use those worksheets, which will be made available to you, whether I send them to you or whether somebody else does. And my understanding is you'll get an email with all this stuff after all this is over. So that's probably when you'll get the whole pile of stuff. If not, you know how to get me. So you can use all of those tools and then make this plan, make an MI friendly plan going forward, and that you have these tools and documents to help you on your way. So there is no set answer with this. I would just like you to think about what you would do and whether what you would do fits in with the stage of change MI sort of approach, which I think is a really valuable way of impacting change. A couple other pieces, just a few end-on things from the new version of the MI book, is it talked about how good motivational interviewing is in a multicultural sense, because it, instead of sort of dictating how treatment goes, it asks the person. So it's built in culturally friendly, because not only does it connect with that person, but it also connects where that person is in terms of their culture. For example, in the early days of multicultural counseling, some of you out there who may have hair my color may remember when multicultural counseling was in its infancy, and they said, well, you counsel African American people like this and Hispanic people like this and white people like this, and it didn't account for the variation within each group. Motivational interviewing, the person is they are the translator of themselves and their culture to you. So it's in a culturally friendly way because they're covering it. And from an ethical standpoint, again, you're not getting motivational interviewing is not manipulating anybody. It's not getting people to do things that they don't want to do. You're helping someone get to where they want to go. You know, more of like a tour guide than a drill sergeant. So next steps going forward, I would recommend both books. And we'll show them in a minute. I showed the last one off in the first session. Changing for Good by Prochaska is a great book. And the new version of motivational interviewing, I believe it's the 4th edition. It's a great book. It's definitely an improvement over the prior versions of it. Much more user-friendly, much more effortless to put into practice. The other one was pretty technical. This is a practice, so you have to do it on a regular basis to get better at it. It's not something you can just call up when you need it. Just pull up the book, dust it off, and use it. It's a daily practice. But I guarantee the better you get at this daily practice, you will be working much smarter and much less hard and generating far less resistance in your clients. Motivationalinterview.org is the central clearinghouse of all information about motivational interviewing. It's out of the University of New Mexico. Bill Miller, one of the inventors of motivational interviewing, still works there. There's a training called the Training of New Trainers, or TNT. It's a great training. It's about 3 or 4 days. They may have changed it since I did it. I took it about 20 years ago. It was absolutely fantastic, and it changed how I do what I do. So I can't recommend it highly enough. They probably do an online version now. Back when I did it, you had to travel somewhere to do it, but that's not so bad either. And as part of becoming a trainer, you join something called the Motivational Interviewing Network of Trainers. They call themselves Mints or Minties, which is terrible, but that's the worst thing I have to say about it. It's a great online learning community that if you ever get stuck working with your clients, you can literally anonymously put a situation up on the listserv, and people from all over the world will answer you. And these people are brilliant. They are scary smart. You can also, if you want to get serious about this and get trained in it more, you can get someone to score you, because self-report is always inaccurate. It's always inflated. We all think we're better than average. And by definition, we can't be. There are many tools that you can use. One thing that I found helpful is just to be able to record yourself. If you can record your half of an intervention, if you're working remotely, And then you can literally score yourself. How many open-ended questions did I ask? How many affirmations did I do? How many reflections did I give? How did I summarize okay? And then on the flip side, did I give advice or direct the person, or did I say anything that was, negating to that person? And you keep score on yourself. I also encourage you to do role plays or real plays with real situations with your colleagues. If there's a client that you're having a problem with, role play that client. Role play that client and have one of your colleagues do motivational interviewing with you, or have them role play the client and you do it with them. Playing the person yourself actually gives you a little more insight into them than you already had. But this is all about getting practice in as real a setting as possible. All right, and we got a lot of stuff in the Q&A. I want to show, I'm going to do the closing, but I'm also going to pull up my email again at the end because there were a lot of requests in the Q&A for the information. And if you don't get it, you will get it from me. So let me do the closing part now, and then I'll go back to that. So we appreciate your time and attention and participation today. Today's webinar was hosted through the DBHR, through the Healthcare Authority. All of this material is going to be sent out to you in a follow-up email. So you will be getting it. I'll be taking the video of this and sending it in, and then it will be getting sent out. So it'll take a couple days, but you'll have my email in case that doesn't happen. If you don't get it in like a week, let me know. If there were any questions that I didn't get to, those you can send right along right away, and I will answer them as soon as possible. Don't forget to check our foundational community support newsletter for all things FCS and for upcoming training events. If you'd like more information on becoming an FCS provider, please reach out to AmeriGroup at the number on your screen. And so the first book is the textbook on motivational interviewing, which is great. Another one, the Moyers article, 8 Stages in Learning Motivational Interviewing. It's really nice about learning how to learn. Motivationalinterviewing.org, the website that I was just talking about. Bill Miller gave us the original version of this slide deck 20 years ago, which was very nice of him. And we have other videos on stages of change and motivational interviewing on our site. So this https sites.rutgers.edu. If you put sites.rutgers.edu, this will come up. We have trainings on addictions, mental illness, trauma, all sorts of things. And they're free. So they're all accessible to you. And I'm going to cut back just so everybody can see the email, because I have a sneaky feeling that when I put it in the Q&A, not everybody gets to see it. So right there at the bottom, ken.kinter@rutgers.edu. Give them a week to send the information out to you so that you have it. And then if you don't get it, you will get it from me. And if you have any questions that I did not answer, because now the Q&A is all full of scores that I asked for, thank you very much. I probably missed a few, so you can definitely email them to me and I will get them and I will return them. All right, so I thank you for your time. We did wrap kind of early, but that's all right. I'm sure you have things to do with your day. So you have yourself a wonderful rest of your day, and hopefully I'll see you somewhere down the line at some other training, or you can reach out and I'll be talking to you soon. All right, so you take care, be well, and I'll catch you next time.